China has finally addressed concerning reports about a spike in respiratory illnesses among children and young adults leading to huge queues outside of hospitals. Beijing last week was urged to provide more information about the spike in cases after local reports claimed hospitals had reached breaking point because of the growing number of patients. Footage from Beijing, Tianjin and Shenyang emerged showing long queues forming outside children's hospitals as parents rushed to urgent care to have their kids checked over after developing symptoms. Parents had reported waiting times to just register to get into the hospital had reached 8 hours or more because of the number of people needing to have their children admitted. Chinese authorities, however, have said the surge of new cases are the result of the flu and several known pathogens rather than a mysterious new pathogen. China's health ministry claimed an overlap of common viruses, and lower resistance after years of coronavirus protective measures, had contributed to a spike in respiratory illnesses across the north of the country. Mi Feng, a spokesperson for the ministry, said data had shown an increase in cases linked to rhinoviruses, the adenovirus, the influenza virus as well as bacteria like the Mycoplasma pneumoniae. Mi said, efforts should be made to increase the opening of relevant clinics and treatment areas, extend service hours and increase the supply of medicines. The World Health Organization, WHO, said data received from Beijing suggested the surge suggested no novel pathogen is involved. Maria van Kerkhove, the acting director of WHO's Department of Epidemic and Pandemic Preparedness and Prevention, suggested children have been especially prone to becoming sick because they are only now coming into contact with pathogens they were not exposed to while COVID-19 restrictions were in place. Van Kerkhove said, "We asked about comparisons prior to the pandemic. And the waves that they're seeing now, the peak is not as high as what they saw in 2018-2019. This is not an indication of a novel pathogen. This is expected. This is what most countries dealt with a year or two ago." China is preparing for its first winter since Xi Jinping's draconian coronavirus measures were lifted, and local authorities have been urged to prepare by opening more fever clinics and promote vaccination. The country's state council said, all localities should strengthen information reporting on infectious diseases to ensure information is reported in a timely and accurate manner.